Many diseases, like stroke, depression, and infections, as well as normal aging, can cause dementia-like signs. It's important not to think any differences are due to dementia. It's very important to notice a GP if you have worries that you or someone you know may have dementia. If the signs are driven by a treatable disorder, they can be diagnosed and treated. Here are 10 signs of dementia you should know. Stay tuned to parshealthhtv. Number 10. Memory loss that affects everyday life. Are you, or the individual you know, forgetting things frequently or struggling to keep new information? It's normal to sometimes forget appointments, coworkers' names, or a friend's phone number, only to recall them a short while later. Yet, an individual living with dementia may forget items more repeatedly or may have a problem remembering details that have lately been learned. Number 9. Difficulty performing routine tasks. Are you, or someone you know, forgetting how to do a familiar routine or task, like cooking a meal or getting dressed? Busy individuals can be so distracted from time to time that they can ignore serving part of a meal, only to recall it later. But a patient living with dementia may have problems finishing tasks that have been normal to them all their lives, like preparing a meal or playing a game. Number 8. Troubles with language. Are you, or an individual you know, forgetting words or replacing words that don't match into a dialogue? Anyone can have a problem finding the right word to describe what they want to express. However, someone living with dementia may forget regular words or may substitute phrases such that what they are stating is hard to understand. Number 7. Disorientation to time and place. Are you, or an individual you know, having difficulties knowing what day of the week it is or getting lost in a familiar location? Have you ever forgotten what day of the week it is or can't recall why you went into your bedroom? It occurs to all of us. Individuals living with dementia can become lost on their own streets, not understanding how they got there or how to get home. Number 6. Impaired judgment. Are you, or somebody you know, not realizing something that can put health and safety in danger? From time to time, individuals may make uncertain decisions, like putting off visiting a doctor when they are not feeling well. Yet, a patient living with dementia may encounter changes in judgment or decision-making, like not remembering a medical issue that requires attention or wearing heavy clothes on a hot day. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Now, let's dive right into the number 5. Number 5. Difficulties with abstract thinking. Are you, or someone you know, having difficulties understanding what numbers and signs mean? From time to time, many people can have problems with tasks that need abstract thinking, like utilizing a calculator or balancing a checkbook. But, a person living with dementia can experience significant problems with such tasks because of a loss of understanding of what numbers are and how they are utilized. Number 4. Losing things. Are you, or someone you know, placing things in areas where they shouldn't be? Anyone may temporarily lose their wallet or keys. Yet, someone living with dementia may place things in inappropriate locations. For instance, an iron in the freezer or a wristwatch in the glass. Number 3. Changes in mood and behavior. Are you, or some you know, revealing extreme shifts in the mood? Anyone can be sad or moody from time to time. Yet, a person living with dementia can exhibit varied mood swings. Differs from calmness to tears to anger for no obvious reason. Number 2. Changes in character. Are you, or someone you know, behaving in a way that's out of their personality? Characters can switch in subtle ways over time. Yet, an individual living with dementia may have more striking personality shifts and can become confused, pessimistic, or withdrawn. Shifts may also have a lack of interest or fearfulness. Number 1. Loss of initiative. Are you, or the individual you know, losing draw in friends, family, and favorite actions? It's usual to tire of housework, business actions, or social responsibilities, but most individuals regain their initiative. However, someone living with dementia may become passive and disinterested and need cues and initiation to become involved. Dementia is not an exact disease but is rather a general word for the impaired ability to remember, feel, or make decisions that interfere with day-to-day actions. Alzheimer's condition is the most common kind of dementia. Though dementia mostly impacts older adults, it is not an element of normal aging. What increases the risk for dementia? Age. The most powerful known risk element for dementia is increasing age, with most issues concerning those 65 years and older. Family history. Those who have parents or siblings with this disease are more likely to get dementia themselves. Race or ethnicity. Older African Americans are twice more likely to get dementia than white people. Hispanics are 1.5 times more likely to get dementia than whites. Poor heart health. High blood pressure, high cholesterol, and smoking raise the chance of dementia if not treated appropriately. Traumatic brain injury. Head injuries can raise the chance of dementia, particularly if they are severe or happen repeatedly. How is dementia diagnosed? A healthcare provider can conduct tests on attention, memory, problem solving, and other cognitive abilities to notice if there is a reason for concern. A physical exam, blood tests, and brain scans such as a CT or MRI can help determine an underlying reason. Share your ideas and experiences about dementia in the comment section below. If you enjoy the video, don't forget to subscribe to our channel. Looking for more amazing videos? Check out the videos popping up on the right and the left of your screen.